All right, hello there, everybody. I'm Gabriel Metcalf, CEO of the Committee for Sydney. You are joining now for today's edition of Committee for Sydney Live. We're so excited today to be featuring Jeff Tumlin, who is the Executive Director of the San Francisco Municipal Transportation Agency, to talk to us about managing a transport system in the age of COVID. It's actually very timely because this week we've begun to see a whole series of announcements about how Sydney is going to manage the transport system in the next phase. So we've heard about the maximum loading factors on the buses and trains. We've heard about a few early steps for pop-up cycleways. This is very timely and relevant. There's a lot still to figure out. So checking into what another city is doing is actually great. So I think you all know I was in San Francisco for a long time before coming to Sydney. Jeff has been a friend of mine for 25 years. And let me just set up his story a little bit by way of background. When I first met him, he was he was doing transport management for Stanford University. He ended up joining a small consulting firm called Nelson Nygaard and helping build it into one of the leading transport consulting firms in the world. He has become one of the most prominent thinkers about the future of transport with clients all over the world, all kinds of projects. And then he ended up getting the chance to cross over and actually run things. First for a 2-year gig for the city of Oakland, and then becoming head of San Francisco's transport system, which is quite unusual in America because it involves not just the operations of public transit, but also control over the streets, which is how things work at Transport for New South Wales, but is unusual in America. Jeff started in December of 2019, a huge job to learn, and lo and behold, 2 months later, the whole world changes. So we are very pleased, Jeff, that you've taken time to join us today to share your experience and your thoughts about managing transport in a time like this. Everyone, you know how this works. Jeff will make some remarks. You can submit questions via the Zoom Q&A app, and then I will do my best to sort through them. And should be good. Take it away, Jeff.
Thanks, Gabe. Hi, I'm Jeff Tumlin, and greetings from San Francisco, California. Gabe has seen many a crisp PowerPoint presentation from me over the years. I am not going to be delivering one of those this afternoon for you because we are all working 80-hour weeks, and if I had done a PowerPoint presentation for you 4 days ago, it would be completely out of date today. So I'm going to give you a stream of consciousness, up to the minute review of what's happening, and I'll probably flash some maps and things that we're working on now. So as Gabe already said, I started this job in mid-December 2019. The first COVID cases happened in China in January. We had the first case here in the Bay Area on January 31st. Late February, the mayor issued her first emergency declaration, and by mid-March, in collaboration with the public health directors for all of the major Bay Area counties, the mayor announced the shelter-in-place order. And then all hell broke loose. We'd been, of course, watching what was happening around the world, and we started getting our first COVID positive cases of our employees at the SFMTA. We have 6,000 people who work in the agency, operating the transit system, managing the streets, running transportation programs, dealing with finance, dealing with parking enforcement. And we were also watching what was happening in some of our sister agencies like New York City, where 100 New York MTA employees have died as a result of COVID. And so we knew that our first priority needed to be protecting the health of our workforce. One of the first things that we did was eliminate the cable car and historic streetcar service because our operators are most exposed on those services. We created a rather generous leave policy, recognizing that a disproportionate share of our workforce were members of vulnerable populations, and we didn't want vulnerable people working in the front line. And so it was, whenever the first Friday in April was, we'd been tracking our attendance rates for our frontline workers and realized that about 40% of our workforce likely would not be showing up the following Monday. So we had 2 days to completely rebuild the city's entire transit system, expecting about a 40% vacancy rate. So we took effectively a radical resiliency approach. We completely shut down the rail system, knowing that it was the most vulnerable part of our system. Even though it offered the highest capacity and the greatest protection for our operators, there were too few people that the system was completely dependent upon, and there were a good chance that too many of those people wouldn't be able to come to work. So we took a bus-only approach, knowing that that was going to allow us to be the most adaptable to change. The next thing we did is we realized there's no way that we could continue operating 76 different transit routes. Things were way too unpredictable in terms of who was showing up in a given morning. And so we stripped the entire system down to the 15 most essential routes. We eliminated 3/4 of the transit lines serving the city and threw all of our resources at the handful of lines that served the most people, served the most essential services, particularly hospitals, and most importantly, provided the most service to the neighborhoods where people had the fewest choices, meaning these were folks who had low incomes and low auto ownership rates, and more importantly, neighborhoods that had the fewest services within walking distance of their homes. This was really important to us, making sure that the COVID crisis, which was exposing all of the inequities in San Francisco at their grossest level, that we needed to make sure that the mobility system did the best that we could by the people who had the least. So that Friday, we started the planning. We had all of our transit planners in, basically working all night over the weekend. Service was a complete disaster the following Monday. Then on Tuesday, I believe it was April 6th, and Wednesday, April 7th, we completely implemented an entirely new transit service that we've been running since then. And while the first week was rough going, it ended up being exactly the right thing to do. And strangely, most San Franciscans understood why we did it, and they could see the logic of the really, really deep cuts that we had made. So this allowed us to provide a remarkably good level of social distance, at least for the first several weeks. It allowed us to stabilize our workforce. It allowed us to adapt to a completely unpredictable environment. Another thing that we did is we abandoned schedules. Since we couldn't really know how many workers are going to show up in a given day, we turned on technology that we had for about 4 years and had experimented with them a little bit, like here and there. And we basically started running the entire system through headway management, meaning rather than asking our operators to meet certain time points, We instead asked them to maintain an even distance between the bus in front of them and the bus behind them. All of this resulted in some surprisingly good news in the midst of a lot of tragedy. In fact, let me see if I can bring up a couple of maps. Hold on a second. I can share my screen. And whoops. Hold on a second. Here we go. Let's go here and let me show you this. Can you see? I'm assuming you can see my screen. We'll hope you do. All right, good. So the complete trashing of the economy as a result of shelter in place saw two remarkable things happen with the transit system. One was better reliability than we had seen in decades as a result of our experiments with headway management as opposed to schedules. More importantly, we saw faster travel times than we had in decades. In some cases, our travel time was in the southwest corner of the city. Our travel time was 50% better than pre-COVID levels. And in our major corridors, our travel time savings was typically between about 20 and up to 40%. This is a phenomenal amount of travel time savings, which meant that not only were we providing our passengers with a better ride, but if we were getting a 25% travel time savings, that meant a 25% improvement in frequency and a 25% improvement in capacity and a 25% improvement in social distancing and a 25% improvement in financial performance at a time when most of our sources of revenue were down between 80 and 100%. In San Francisco, fares represent only about 20% of our revenue. The bulk of our revenue comes from sources like parking fees and fines that were down nearly 100%. So this was some good news and led us to some thinking about recovery planning, which I'll get to in a second. How am I doing? So let me talk, before I get into recovery planning, about some other key themes that we were struggling with. So I've talked about our huge emphasis on protecting the health of our workforce. And it is with great relief, and let me knock on some wood here someplace, we have had a grand total of 12 COVID positive tests in an agency of 6,000 people. And so far we've had 0 fatalities, which makes us, I believe, have the best health and safety record among the large operators in the United States. This is phenomenal, particularly considering what has happened to cities like New York, Detroit, New Orleans, which had a lot of suffering. So by really focusing on the 100 small things that are necessary in order to protect our workforce, we've had a very good health record, and that is starting to allow more of our workforce to come back, which means we're able to deliver some additional service. The other key theme that we've been operating on is understanding why transportation exists. We're not in the business of eliminating congestion. We have no control over congestion. Congestion is an economic phenomenon that has very little to do with infrastructure. We in transportation serve a fundamental purpose of driving the economy. We are fundamentally in the land value and economic development business. And to the extent that we're in the economic development business, we're also in the social equity business. We decide winners and losers by expanding access. And we're also the primary driver of not only air pollution, but we represent 50% of San Francisco's greenhouse gas emissions. So in the COVID crisis, we know that we have to do everything that we can to bring the economy back. And so that has been central, along with protecting health, to our recovery effort. And I'll talk more about that later. And at the same time, there have been some key themes that are causing us a lot of concern. One is we're watching the, let's see, let me share the screen. We have been carefully watching what is happening with, in other cities with the, with rising congestion. As people retreat in a fear-based way away from transit and towards driving, the geometric limitations of different modes of transportation kick in. I'm not widening any streets in San Francisco ever again. And so there's a fixed geometric limit to movement in the city. And it takes up between 10 and over 100 times as much space to move somebody in a car as it does to move them in a bus or a train. So a relatively small mode shift from transit to driving results in an unprecedented level of traffic congestion. And we're already seeing cities in China that are experiencing greater congestion than they did in the pre-COVID days. And as a result of this extreme congestion, their economic recovery efforts have completely faltered. I can move a lot of people on San Francisco streets, but I can never move more cars than I did in January of this year. So we are focusing our economic recovery efforts in a couple of ways. One of them is in making sure that the travel time savings that we got during the COVID time, that we maintain those travel time savings moving forward, because otherwise the city's entire economy is going to be strangled. And I'll show you some of those later. Another thing is that we're realizing is that, okay, if we can't convince everyone to get back on transit, the other opportunity that we've got is getting people on bikes and on scooters and on skateboards and in wheelchairs and walking. The same geometric benefits apply to bikes as transit. And so we have been investing in what we're calling Slow Streets program, led largely by the success in our neighboring city of Oakland, where we've been slowly rolling out a series of streets all over the city that limit through motor vehicle traffic and slow car traffic down to bike speeds. These are all framed in the name of protecting public health, but we also understand the necessity of piecing together a citywide network of fully protected bike and scooter and wheelchair streets that will allow people of all ages and abilities to be able to access their neighborhood commercial district without having to get in their car, and to be able to get to work anywhere in San Francisco, even with our crazy topography. So you can see on the map that we're starting to piece together a network here in our phase 2 planning. We're starting to get more aggressive in our phase 3 planning and hoping to, if this works, to have this network lead towards something that is more permanent. We are building about 2 miles a week of these. So we've completed, actually more than that, about 4 miles a week. We've completed 13 miles and are on our way to completing 35 miles about 4 weeks from now, and hoping to more than double this network in the coming couple of months. What else are we concerned about? We are deeply concerned about widening inequity in one of the most unequal cities in the world. And we're struggling to figure out how to serve our more isolated neighborhoods that also have our working class residents and our residents who have been most affected by the economic devastation of this virus. And we're also particularly concerned about the fact that the vast majority of our low-wage workforce cannot afford to live anywhere near San Francisco. These are folks who are enduring 2-hour commutes each way, commutes that have gotten a little bit faster as a result of the drop in congestion, But if the regional congestion levels come back, as we're expecting they will in August, our low and moderate wage workforce is going to be devastated not only economically, but in terms of the amount of time that they'll need to spend accessing opportunity. We want to make sure that that does not happen. What else do I want to cover? Another key concern that has been a major theme of our work is the emotional cost of the pandemic. And that emotional cost is impacting us in two particularly key ways. One is our workforce. Our workforce, I mean, I spent my entire career in the private sector and carried with me a certain amount of prejudice of public sector workers, clocking in at 9 and clocking out at 5, and otherwise taking it pretty easy. Never in my entire career have I seen a harder working workforce than my colleagues at the SFMTA, and this is throughout the agency, like everywhere in the agency. Our entire workforce is putting in endless hours, and I am deeply concerned about the level of exhaustion that they're putting in an amount of work that is not sustainable. And more importantly, they're doing it at a time when they are emotionally exhausted as well. The fact that so many of my colleagues are having, children at home that, with their schools and daycare centers closed, that they're taking care of elderly parents and other people who are members of vulnerable population groups. And of course, here in the United States, when you lose your job, you also lose your healthcare. And so the level of fear, given unemployment that is now exceeding 20%, right? Where 20% of people in our region have not only lost their income, but they've lost their basic healthcare. It's creating a kind of intensity of trauma that we need to be doing more work to take care of. So this is affecting not only our workforce, but the entire public. Like, all of our passengers and the public that we serve are consumed by fear. And if this fear is not dealt with in a way that distinguishes between the health science of what actually increases exposure and what is necessary to flatten and decrease the curve, versus the emotional reality of how people are making decisions on a day-to-day basis, like, we are not going to recover from this situation. And so we realize that public transit, like restaurants, like cities themselves, require a sense of us all being in this together. They require a sense of joy in our shared experiences in cities. It requires a sense of conviviality. And that is hard to do if we're afraid that going into a shared space jeopardizes our health. It's hard to do even if you feel comfortable in that space with something covering half of your face. We're tribal social primates, and we get a huge amount of social information every day from facial expressions. When 2/3 of those facial expressions are gone, our brains don't know how to respond. And this is going to be a unique challenge that many industries are going to have to face, including public transit, if we're going to recover with a full amount of success. So let me skip really quickly to our recovery planning efforts, and then I want to make sure to leave plenty of time for questions and answers. So let me bring up some of that work that we are doing to show you how we are framing it. This here. Yep. So this is still in very rough draft, and we're going to be revealing it in public tomorrow. But it is building on a lot from what we're learning, particularly from the East Asian democracies. Really, the only places in the world worth paying attention to. I don't even know why you're listening to me. Pay attention to what Seoul and especially Taipei are doing. because their work is directly relevant to what we in the Western democracies can be doing. And then, of course, pay attention to the Western European capitals, particularly what they're doing with regard to rapid expansion of protected bikeways and open streets. For each level of ratcheting down of shelter in place, and particularly for us, this means things like the beginnings of the opening up of stores and how we need to respond with managing the curb, to the beginnings of opening up of restaurants and how we need to commandeer street space to allow restaurants to survive by moving tables outside into what is now streets and parking, to the opening of schools, which is will be a big burden on the transportation system, to the ongoing opening of conventional offices. For every single line of work that we do as an agency, we're looking at what we need to be doing in advance to prepare for each of those levels, while working to forestall the likely unintended negative consequences of each phase. So, for example, the opening of schools. If all parents start driving their kids to school, that will be a complete catastrophe for the entire mobility system. So we know that we need at least 3 weeks to get ahead of that problem, and we need to be collaborating with the school district in order to shift school opening times and really get kids to feel safe walking and biking. For Muni, for our transit system, it means understanding from Taipei that social distancing does not work on transit. That it is essential that we get everyone to wear facial coverings and to wash their hands, and that means doing theater such as public temperature checking. It means doing substantive work like really frequent cleaning of all surfaces. And it means understanding the epidemiological research around the nature of transmission rate times the time of exposure times the value of the activity, knowing that the economy is completely dependent upon successful public transit, and that if you can mitigate exposure, you don't need to rely on social distance, and you can make transit actually functional, particularly if you protect transit from being stuck in congestion ever again. And now's the time to do that work. We are going to be proposing later this week a 5-fold expansion of transit-only lanes in San Francisco. We don't know if we're going to be able to get all that, but we're forcing a conversation out loud and in public of making some really, really difficult choices before we're strangled with traffic congestion. We're also, as I've already told you, talking about rapid expansion of our slow streets and open streets programs. We've already closed our West Side Highway and hope to maybe never open it again because it is being so heavily used right now by people basically training their kids how to bike and skateboard. But all of this approach allows us to get ahead of the communications and to think about how we do storytelling in public about the changes that are forthcoming. We are still at the beginning stages of a long, slowly unfolding tragedy. This situation is going to be with us for a long time, and unless we take really decisive action right now, and particularly in the next 3 months, our economies are not going to recover, at least for a very long time. And in order to have these difficult conversations, we need to have some frank discussions, again, about what transportation is for, the ways in which it serves the economy, the ways in which we make choices about who benefits and who disbenefits, and most importantly, the ways in which our emotional reality decides the mobility choices that we make. And unless we can make people fall in love with cities again, and unless we can make people feel safe and convivial in restaurants and on public transit, we're not going to get through this well. But on the other hand, if we can do all of that, we have a remarkable chance here to really set our cities up for decades of future success. And with that, I've been rambling on for a long time. I think we're at time, so why don't I stop now and we can have some discussion.
Okay, Jeff, thank you so much. Yeah, really inspiring thoughts. And I see a bunch of questions coming in. Everybody, again, please feel free to submit them via the Q&A app on Zoom, and I will do my best to sort through them. All right, Jeff, when you said it's essential to maintain the high loading factor, but make sure everyone wears a face mask, that's not what they're doing in Sydney. They're trying to reduce loading factors. Why, in your view, is it essential to do it that way?
Well, so I think that it's a little bit of both. So we are still trying to enforce social distancing on our transit system right now. But we know that as the economy comes back, the math of that no longer works. We can't deliver enough service. So right now, for an 80-foot, for a 60-foot bus, our guideline is only 30 passengers, which is it's about a fifth of our usual capacity. So that works when the economy is 80% down. It does not work when the economy comes back to even 50% of its former level. So we know that we're going to need to make a transition from using primarily social distancing to using other approaches to mitigate risk. It also becomes a lot easier. I mean, and again, this is part of the lesson from Taipei and Seoul. When you have really sophisticated contact tracing, something that, probably Australians, just like Americans, are going to get uncomfortable with, the level of privacy control that is necessary to alleviate in order to let contact tracing happen at the same level that it is in the East Asian democracies. So we're struggling with this all right now. We're taking guidance from our Department of Public Health, but also, again, advocating about the importance and the unique position of transit and the opportunity to learn from Taipei and Seoul.
And Jeff, people may not know, but as I understand it, you're required to wear a mask now in San Francisco if you're in public, right?
So yes, you're required to wear a mask in public, or you're required to carry one, if you're out jogging. You're required to wear one. There's not much enforcement yet. On public transit, our operators will pass you up if you're not wearing a mask. And right now we're still in the stage of the police department providing masks. Like if you don't have a mask, they'll give you one, and they will also give you an admonishment. We're trying to make a hard decision about when we start doing rigid enforcement of that. Several other US transit systems do rigid enforcement of face covering requirements.
Yeah. Jeff, a couple questions have come in from avid cyclists. People in Sydney say a lot of the time that it doesn't work to have widespread cycling here because it's too hilly. What's your answer to that?
So yeah, we can match your hilliness, I assure you. We're seeing an unprecedented level of cycling, rates of cycling I've never seen before in all my 30 years in San Francisco. And in fact, most of the bike shops in San Francisco have seen their sales increase by 50 to 100% month over month. So what we find, and Sydney and San Francisco share some of these characteristics in that the pre-war portions of Sydney are basically streetcar fabric, and streetcars have exactly the same grade requirements as bikes do. So in San Francisco, while we've got some real topography, there's usually a way around the topography by following the historic streetcar routes. So that's kind of what we're doing, and we're making really tough choices about matching, about connecting neighborhoods along the most level possible routes in order to link up the whole city. The other thing, of course, that we're seeing is a huge increase in electric assist bicycles. E-bikes make all of San Francisco flat. I live on top. I live at 300 feet of elevation up a really steep hill, and I bike up and down it in a suit. And I, choose how much assist I want my bike to give me, depending upon how sweaty I want to get. And I gave up my car before I started this job. There's really no point in having a car in a city like San Francisco anymore.
Jeff, we're curious how you are managing the relationship with the major employers. Are you doing anything to encourage employers to keep their office workers at home in order to reduce demand on the system? And if so, at what magnitude and how long do you see that happening?
So San Francisco's economy has shifted very much towards high tech. And an advantage of this is in technology, it has been very easy for most of our major employers to keep functioning while nearly 100% of their workforce stays at home. They are seeing a lot of benefits in this, including employee morale. And we've been having very nervous conversations about how much do we need to require employers do transportation demand management at a time when they're really suffering. What we're finding is most of them are doing this voluntarily. Many of our largest employers have said they don't expect anyone to come back to work until the end of the year. And to the extent that some of them are coming back, they're concerned about elevator capacity. So elevator capacity, interestingly, is forcing them to have conversations about spreading out their peak and thinking in sophisticated ways about shift, and in sophisticated ways about keeping as many of their workers home. That said, a huge chunk of San Francisco is also service industry. It's our restaurants, it's retail, it's the hospitals, and it's people who are working security and being dishwashers. All of that travel is coming back, but it's fortunately not very oriented around the conventional peak. It's been fascinating to us watching how our travel patterns have changed dramatically and continue to do so. So a lot of businesses reopened this morning, and none of that has resulted in a return to January levels of travel patterns, because the offices probably are not going to be coming back for some time.
Yeah. Jeff, when you said the goal is to make sure public transport is never stuck in traffic again, and of course, if it's in a subway, the problem is inherently solved. But on the surface, what do you do to make sure that that buses and streetcars are never waiting in traffic? What does that look like for you?
So for the most part, that means clearing out dedicated lanes for buses. We've done a lot of that in San Francisco already, mostly in the downtown. We are looking at doing a very rapid, dramatic expansion in this 2-month window that we have. We don't know if we're going to be able to pull that off. We will start to reveal our thinking about that this week, and want to actually complete the work within 2 months. So our limitation will be, politics largely, but we're getting a surprising amount of support for this notion. I mean, people see what is happening in the Chinese cities and know how devastating that would be for the economy and quality of life of San Francisco, and how grossly inequitable it would be. So I think particularly our slow streets efforts, which we've been moving very quickly on and making rapid changes. So we've demonstrated our ability to listen and to make adjustments when our initial experiments don't work. We're getting kind of more trust as an agency to do experimentation in the streets. Something else that we'll likely be experimenting with is, so the San Francisco subway is rather complicated, where we have 5 surface lines that convene and enter a subway together. And as a result of that, our subway is very unreliable because of where things get stuck on the surface and the trickiness of going on and off automatic train control at the portals. We may limit the number of train lines that go back into the subway. The J Church line may not ever go back into the subway. And riders actually understand how this could benefit them. It also means then that we can provide far more capacity, frequency, and reliability in our existing subway by completely rethinking the system. Like, this is a really once in 100-year opportunity to put the system back together again differently and better. Most of our transit system is really unchanged since the city bought United Streetcars in 1912 and simply took over 3 competing streetcar operators who had competed against each other by buying franchises on parallel streets. It was never put together as an integrated system. We've inherited 3 competing systems that were fighting against each other.
That cliche, "Don't let a crisis go to waste," which is often these days wrongly attributed to Churchill, but it's actually Rahm Emanuel.
I thought it was originally Churchill. I mean, Rahm Emanuel definitely quoted it, but Rahm Emanuel.
Well, we'll go to Wikipedia after this and find out. Anyway, the thing about not letting a crisis go to waste is you have to know what you want to get done when the crisis hits, which as a student of the San Francisco transportation system, you did. So yeah, well, it's an opportunity.
But I think more important than just knowing what to get done, you've got to have razor sharp clarity about your values. And that is something that I think San Francisco has tried in a sporadic way to do in the past. I mean, we passed the transit first policy in 1973 and then proceeded to ignore it for 50 years. So the thing that we keep coming back to in our messaging is our San Francisco values and the need to make hard choices and framing everything in, look, we've got limited resources, we have limited street right-of-way, these are the problems that we know are coming at us. Do we do this or do we do that? Which is in greater alignment with our local values. It is clear that the easiest thing to do would be to continue with our past patterns. And we know that that only benefits the most privileged. And it creates the greatest harm for the people who are already being exposed to the greatest harm through the pandemic. And so we're able to create a kind of different political alignment by speaking to at least what we say are our universal values here in San Francisco. And it's giving us an opportunity to clarify, are these really our values? Or
yeah, by drawing out what the consequences of those values are. That's a good segue, Jeff. A few people have asked about Backlash, which certainly we've seen all over cities all over the world. I mean, as Bloomberg built the cycle network in New York, they began to call it the Backlash. He had the political strength to ignore it, essentially. But sometimes the backlash is not just resistance to change. It's businesses who are facing a lot trickier or more expensive process of managing logistics, so loading and things like that. How do you navigate those kinds of issues?
Yeah, so we've been trying to be very conscious of that and not take advantage of the crisis, or not take advantage of people as a result of the crisis, but instead lead with a people-friendly and business-friendly approach. So our slow streets have all been low-volume residential streets, and the approval rating based upon the comments that we get, like we never ever get like grateful comments in a transportation department. Of the comments that we're receiving, about 90% are positive. Well, that's not true. The setting aside, the bulk of the criticism has been Like, why are you doing like that street instead of my street? There's been very little complaining about the projects themselves. For our commercial districts, everyone realizes how vulnerable our small businesses are, and that change is absolutely essential, particularly given how important restaurants are to civic life. And so we have been gently fostering some conversations with our merchants associations in individual neighborhood commercial districts and getting them to make proposals to us. So just this weekend, we announced the first of our restaurant streets, where we're taking, 4 really prominent blocks in the middle of North Beach, wiping out all of the parking, and turning the entire street over to restaurant tables at the request of the Merchants Association and the local supervisor. That is now like having all the local supervisors competing against each other to like who can do the next one. So
incredible.
Right. So it's hard striking the right level of humility in all this. Like, we've got to put the ideas forward and express the urgency. But we need the ideas to be coming from outside the agency. That where our job is like, we're the implementation people. It's our job to strip away all the bureaucracy and allow you to do your good work. We also find we don't have the capacity to manage all 35 miles of new stuff that we're doing. Like, we can't manage that, especially when our revenue is tanked. We need to make sure that there's ownership by the neighborhood associations on the residential streets and by the merchants associations on the commercial streets. Otherwise, it's going to fail.
Yeah. A really thoughtful question. It sounds like many of the actions you're putting in place are aligned with long-term strategies, either explicitly or implicitly. But has COVID forced any changes to plans as opposed to accelerating plans?
That's a good question. Well, I mean, we had a lot of construction projects that were stuck in the shelter-in-place order. We have, we're losing, we'll lose $250 million this quarter. And we're not expecting our revenue to get back to pre-COVID levels for 3 years. So we're working, we will be shrinking significantly as an agency. My task is to thread the budget needle so that we don't have layoffs. And I think we can do that. We may be one of the only transportation agencies in the United States that avoids layoffs. Some of my sister agencies are looking at in excess of 40% layoffs. And again, a reminder, when you're laid off from your job in America, you lose your income and you lose your health insurance. So then it's just completely devastating. So there's a lot of capital projects that will be abandoned. So in January, we were planning dramatic service expansion and new revenue measures. All that is gone. We're looking at not bringing back, we're looking at what do we not bring back from the system. And a lot of hiring that we were planning. I was in the middle of creating a new Office of Race and Equity. Can't do that. It's slash and burn. I just cut our employee wellness program. Yeah.
So some very, very painful cuts. You're trying to make the best of it and talking about the opportunities and the crisis, but not all of those.
I can tell a rosy story, but this is horrible. What we're going through here is, and it's a long, slowly unfolding tragedy. We are nowhere near the end.
Jeff, several listeners have noticed that you speak very positively about scooters, which is not something people in Sydney are used to hearing transport officials do. Why do you like scooters?
Oh my goodness, scooters are great now that we finally worked out some of the problems. Uh, San Francisco, so we had kind of poor initial rollout of scooters in San Francisco. And the initial reaction was to kind of over-regulate and to regulate focused on just controlling their numbers. We're taking a very different approach to regulation now at the SFMTA, where we start with our values and our fundamental responsibility to manage the public right-of-way for the public good. And that requires defining what we mean by the public good, and then having a conversation with mobility technology providers to say, look, these are the problems we have. Here's how we measure success. You are welcome to profit off of the public right-of-way, but only insofar as you uphold the public good. So for scooters, we saw some really positive use case in that, like first and last mile connection to transit, for increasing number of people, the entire commute. We saw some also really serious problems, like riding on the sidewalk, like the fact that they are unstable and tip over and become tripping hazards and block wheelchair access. So we decided to focus on heavy regulation of the problem by requiring all scooters to be tethered up to something when they're parked so they don't tip over, by requiring the providers to use their fine GPS in order to track bad behavior and stop that. And they can figure out how they're doing that, but we were going to be counting and eliminating their permits if they allowed their users to do stupid things. It also meant that we needed to, and it kind of gave us an excuse to dramatically upgrade our protected bikeway network. So in the last year, we've added, 15 miles of protected bikeways, and that provided a space for the scooter users to operate in. And that then made everyone feel comfortable dramatically expanding the numbers in exchange for focusing on the real problem and eliminating that and then capturing the upside. So we're having, there's still, some cranky people out there who are upset with scooters, mainly because they're young people use them, and, who doesn't dislike young people? They're having more fun than we are. It's horrible. It should be stopped. So yeah, that's a kind of long version, but it's a set of lessons that we're actually applying to all forms of privately operated mobility, is completely restructuring things to focus on maximizing the public good and regulating against specific negative outcomes.
So that would apply to Uber and Lyft and shuttles and new things that haven't been invented yet.
That's right. Well, and particularly for us, autonomous vehicles, which we're particularly terrified of. So San Francisco is the corner of the world that has the highest rate of testing of autonomous vehicles. There's real upside, but there is absolutely catastrophic downside. We want to get ahead of the regulation by partnering right now with private industry to get them to understand our concerns, as well as the things that we're really happy about, and then get the state and federal regulation aligned with that. Because right now the federal government is, our entire federal government is a disaster. I think we've managed to stop the federal legislation that was pending, getting them to understand the notion of unintended negative consequences.
Yeah. So what are you worried about with autonomous vehicles, Jeff?
So autonomous vehicles are basically Uber and Lyft at a 50% lower price point. So for us, ride hail, we've seen dramatic increases in their contribution to traffic congestion, to traffic fatalities and crashes, to greenhouse gas emissions, to a reduction in accessibility for people in wheelchairs. Every indicator of success, Uber and Lyft have destroyed. And that is not to say there isn't a really, really powerful and positive use case for ride hail. We really want ride hail to be successful, but their current business model post initial public offering is really chasing after more exquisite convenience for the privileged at the expense of everyone else. And the way they are currently regulated by the state encourages Uber and Lyft to maximize bad outcomes. So we're trying to change the regulatory structure in order to get some good and minimize the bad. Autonomous vehicles are the same thing, and they have the same geometric problems, right? It takes up 10 times as much space to move somebody in a car as it does in a bus, 10 times as much space in an Uber, 10 times as much space in an autonomous vehicle. So to the extent that autonomous vehicles are super convenient, but deeply inefficient, it causes a huge problem for cities. Suburbs are a different case. Like autonomous vehicles, great in the auto-dependent suburbs, really potentially problematic in cities unless they are regulated appropriately. So that's what we're working on. There are other problems as well, but that's a whole other lecture.
A question about air quality. There's so many great questions that have come through, but you mentioned that the transport sector is responsible for half of greenhouse gases in San Francisco. But a related issue is air quality. We've seen cities like London really try to directly take on the air quality impacts of cars and trucks. Are you contemplating anything like that?
So we're having some conversations. So San Francisco is fortunate that our notorious fog tends to blow our air pollution to our neighbors. So air quality tends to be good in San Francisco proper, except in certain locations at the ground level as a result of ozone and particulates. Where we're really concerned is in West Oakland. Our neighbor, there's the big gray bridge over the bay goes to Oakland. And because of our antiquated thinking about bridge tolls, we underpriced the bridge at peak, and that results in a massive queue on the Oakland side of the bridge. And that queue coincidentally happens to accumulate in a low-income, predominantly African-American neighborhood full of kids. And as a result of that, the lifespan of children growing up in West Oakland is 15 years lower than children of the same demographics growing up in any other neighborhood because of where we choose to store the queue for driving across the Bay Bridge. We're hopeful that the threat of catastrophic levels of congestion on the Bay Bridge and the dire financial strait that all the transit operators are in may actually allow us to have a grown-up conversation about the need to use price rather than time to balance supply and demand in mobility. We're Americans, somewhere in the Constitution that, because America is the land of the free, that roads, I think, also need to be free. I think it's in the Bill of Rights. I forget where in the Constitution. But it's a really, really hard conversation for Americans to have, to think that we might use the same technique for balancing supply and demand in mobility that we use for food and clothing and housing and our cell phone bills, rather than forcing people to stand in line and to waste their time.
Pricing, you mean? Yeah.
Yeah.
Yes. All right. Jeff, this has been an extremely helpful window into how you are thinking about all of these issues, about the future of transport. And so many of these issues apply directly to things we need to figure out here in Sydney. We would have hopefully had you here in real life had the pandemic not intervened.
I have a real fondness for Sydney.
Time. Yeah.
All right. I'll see you next time.
Well, maybe someday. Everybody, thank you for joining Committee for Sydney Live. We'll see you at the next one.
Stay safe, be bold, be fearless, be compassionate.